Good morning. My name is Luca Piovano from Italy, Rome, and I will speak with you my experience in the last 2 years in the treatment in aesthetic medicine and in plastic surgery during the pandemic COVID-19. What's happened? What's changed in our profession? What we have to see in our next future? That are my disclosure. And that is the situation nowadays, just yesterday in Italy and almost in Europe is very similar. So we have the fourth waves of COVID, and but the case of death are very little. Why? Because in Italy we are lucky and we have a high level of vaccine. Almost 80% of people have been 2 doses of vaccine. And now we are doing to do the third dose of vaccine. So the COVID is enough active in Italy and in Europe, but we have no downtown, we have not closed our profession, our activity, but it's a little bit change. And that was the situation just 1 year ago. Just 1 year ago, the ILAD was high, but also the deceased patient, the death, are very high. So that is a survey that we do in all region of Italy, in different sex, in different age. And when we start again after lockdown of 1920, the activity, the medical activity, we ask to the patient in the survey what they want to know from the doctor at the first meeting. When we resuming medical activity, what do you like your doctor to explain to you before a visit or before a treatment? Nothing special. I trust my doctor, so nothing changed for that. I want to know what protocols you have adopted for safe reopening. And it is the majority, almost 47% of people ask the safe treatment in your office, in your facility, in your clinic. And finally, just a little bit doesn't come to the doctor. We still have less than 10% of patients, they stay at home and don't want to come to the office, to the hospital to have treatment because they have afraid of contact with the world outside. If before the total closure you had planned important surgical or non-surgical treatment, do you feel ready to reprogram it? And the majority of people, yes, now I can. We can do the surgery that we planned before closing, before lockdown. So our activity now is fully booked because we have the new patient, the old patient to treat. We have a lot of work to do. And no, rather because I don't feel safe, just 22% of patients don't want to have anesthetic procedures. They do only the very important procedures like tumors or cardiopathic patient. How many financial resources are you willing to devote to the surgical or non-surgical treatment compared to before an health emergency? That is another problem because the COVID give in the people a big problem of financial problem, less work and the activity was down, was closed. So that is the answer of the survey. Is 40% of patient reduce to go to the doctor, to the aesthetic doctor, to the aesthetic practitioner. Only 40%. 60% are willing to invest enough in the same amount of money. So I finally 15-50. 50% don't want to come because they have no money. 50% continue to have to come to you for the treatment. And now the last question in our survey that we conducted last month in Italy. It is difficult time. How I feel also depend on how I see myself. Yes, the period is very difficult for everybody. The interpersonal meeting, contact, the traveling, blocked. But finally enough patient is the middle 41%, little reduce 16 18, very much only 80% don't want to do anymore, nothing. Finally, in this period of total closure at home has resulted in multiple answers possible. A lot of people, have a worsening of my psychological state. More people have worsening of my physical state because the sedentary, don't moving, no gym, a lot of eating, no activity. The physical state was in a good state for the majority of the answer. Improvement of my psychological state, just 10% of people. Improvement of physical state, only 8%. No change is 28%. In my experience, in my opinion, the first two, the psychological state and the physical state, change a lot during this pandemic life. In conclusion, our survey will be published in Aesthetic Surgery Journal in the next month. And we have good news and bad news. Some people in some region, like in north of Italy, where we have 52% of total death in Italy. So the COVID was more aggressive in north of Italy. The patient responded that they also ready to reprogram surgical and non-surgical treatment in 54% of patients. So patients don't seem to be worried about knowing the safety protocols adopted. The lockdown and an ongoing tragedy, both medical and economics, has not affected patients decide to resume treatment. So finally the life go on. And now I want to share with you another congress that I take part in just 1 month ago, and the theme of the congress was how the COVID-19 pandemic has affected plastic surgery treatment in hospital. So non-aesthetic, but the treatment in hospital. Thank you to Professoressa Onesti for giving me his experience in my university. And we talk about the breast cancer. Breast cancer go on with COVID, and all the surgery that we do, the treatment have a little problem. Why? Because in COVID hospital we have a reduction of the place for plastic. The surgical division was closed, and then we have a lot of patients are afraid to go in hospital COVID. So what we do in hospital? We change a little bit the admission, the admission in the facility, doing a pre-hospitalization, the admission, the COVID test increased, more testing at first, and when the patient go out to have a safe admission. Fortunately, we have no infection in the medical staff by COVID in the plastic surgery division. And talk about the mammary reconstruction. Mammary reconstruction is not urgent surgery like the breast amputation of tumor, the tumorectomy, but they need a reconstruction. So we work on reduction of the contact, and we have no incidents in the compliance. What we forget? We forget some kind of surgery. The second step, reconstruction, is not urgent, delayed. The use of big surgery, like use the free flap, big surgery, no delayed. Next section. The aesthetic of other breasts delayed, no in this period, forget it. So only the team, the breast unit, the team continue to assist only the urgent cases. And what we do in my facility, all the people take the mask, 1 or 2 masks to cover the diffusion of virus. We take another interesting device, a DPI. DPI is a covering of all the face with glass. It's a nice device to use now during this period. I never use, but now I use. Prophylactic, the distance, no contact, less patient, very low, no contact with patient. The big distance from one patient and other patient, from one patient and operator. And last but not the least, the hygiene of the hands is very important. Wash hygiene, use alcoholic solution for the hands, because the diffusion is through the hands touching. And what we do, my assistant in my facility, telephone triage, we ask to the patient before coming in the office about his situation, his temperature, his relatives, what they say, if they are able to come in our office or no. And then if they come in office, we do a triage in office. Triage in office we relieve the temperature, we see the patient, we disinfection the patient, we make a good anamnesis to the patient. And in this way we reduce the diffusion of the virus in our office. So less visit, less patient for day. But what you are interested, what do you change in my treatment in patient? This is typical patient. This is my assistant. Look, she work with the mask. She go out at home with the mask. She stay all day on the mask. She is lady. So what we see for this lady? The eyes and the forehead. So we have a lot increasing of treatment of the peri-orbital rejuvenation and eyes. We have a decrease of treatment of the lower third of the face. We treat mostly the upper face. But we see from the paper that nobody knows job how the pandemic led to a rise in plastic surgery. In fact, the aesthetic surgery, aesthetic medicine during the pandemic has caused a boom in plastic surgery, especially in some areas, some tricky areas. And now go on the problem of the area: crow's feet, blepharochalasis, high bag, skin flaccidity, high brow symmetry, brow rarefaction, and again high bags in men, malar fat pad, eyelid laxity, nose orbicularis sulcus, eyelid pigmentation. So we have a lot of work to do for this area, a lot of problem, a lot of work to do. Look, this patient, transgender patient with black rings around the eyes. And what we do blepharoplasty in plastic surgery, lower, upper blepharoplasty, different way, different manner, skin flap, myocutaneous flap, mixed flap, extended blepharoplasty. We use a lot of lipofilling for the correction of the periorbital rejuvenation. Why? Because lipofilling give me volume, give me stem cell, give me rejuvenation of this area. It's very good opportunity to increase the treatment of lipofilling of the periorbital area. And in the contrary, with hyaluronic acid, we have a lot of lumpiness, a lot of complication with hyaluronic acid. So, hyaluronic acid, calcium hydroxylapatite with nodule, non-surgical blepharoplasty is not recommended in my hands. I propose to you very soft treatment for the eyes. Look, this lady, poor skin quality, and we do topical treatment, dermapen with botulinum toxin and amino acid. Dermapen to revitalize the skin, to reduce the wrinkle, and then we put some amino acid, hyaluronic acid, peptides, and something like that to improve the skin quality. Other patients we need injection. It's not necessary to treat only with the skin with topical use, but we need injection with amino acid and botulinum toxin and hyaluronic acid free HA. It is very, very delicate, and this improve a lot the eye area. But if you go on a little bit down, muscle elevator, the pressure, we have a lot of muscle to work on it, and it's good opportunity with botulinum toxin in good hands to have a good result. But you have to study to see your patient. If you do only botulinum toxin planning treatment, we make complementation with filler. So the best result is botulinum toxin plus calcium hydroxylapatite or HA filler in combination. But now in the COVID period, we use a lot of vaccine and we use a lot of hyaluronic acid. And that is the situation. The situation is this an evidence. It's not situation. It's an evidence that there is an interaction, and that is an alert of ISAPS, International Society of Aesthetic Plastic Surgeon. Is an alert about the combination of injection of hyaluronic acid and vaccine in the same section or just near, because there is a reaction between the two drugs. In fact, the COVID-19 vaccine triggers reaction in some dermal filler patient. So what we do? We do hyaluronic acid or we do vaccine? You have to decide. COVID vaccine and filler we can do, but we have to manage in the right way. We can do, but we have to study to manage. That is our protocols. We stop to inject hyaluronic acid 15 days before administration of vaccine, and we wait 30 days following the administration of vaccine to inject hyaluronic acid to evitate the complication of reaction, edema, nodules, and something like that. So in this period, before 15 days, after 30 days of vaccine injection, no treatment in Italian country. Now we move to surgery. Surgery we can do in combination with vaccine, no problem, and for more surgery, construction, elevation of the eyebrow, the eyes, and a lot of approach, endoscopic approach of eyebrow here, retrograde approach of eyebrow, mediofrontal approach of eyebrow. Look, these ladies, poor skin quality. We cut the skin, we suture, immediately post-operative, and after 1 month, 1 year, no more scar evidence. The open of the eyes is very, very good. Corrective method, pre-capillary approach. Direct approach to correct the high you are. So a lot of surgery we do. Finally, that is eyebrow elevation and for this lady, and again upper blepharoplasty and elevation of eyebrow of this lady. That is intraoperative planning for this lady. Elevation of eyebrow. And that is before and after. Good shape, more feminization before and after little surgery. So the procedure is very simple. I have a new kit for to do this in safe way, these procedures, and I will share with you as soon as possible. And finally, I have a little video for you.
Hi, good evening. My name is Luca Piovano and I am now in my operating theater. I am just finished a big surgery day. After COVID period, we have a relaunch of surgery. We have a lot of different surgery from the less invasive procedures to the big reduction of mammoplasty and abdominoplasty, tummy tuck, and something like that. So, as you know, in Europe, in these fourth waves of COVID, the situation is surgical situation is normal. We perform in Italy and in Europe a lot of surgery, aesthetic surgery with no problem. Finally, I wish all of you a Merry Christmas and Happy New Year. And the New Year 2022, I think, will be the ending of this epidemic SARS-CoV-2 COVID. And see you tomorrow directly in Jakarta, all of you. Bye. Hi.
Thank you, bye, and stay tuned for tomorrow. We have another interesting presentation for you. Bye bye, Indonesia. Arigato.